And further afield, an advisory committee to the United States of America's Centers for Disease Control and Prevention, CDC, has reviewed the recommended age for administering the combined MMRV vaccine, which protects against measles, mumps, rubella, and chickenpox, over the potential risk for febrile seizures among children below the age of 4 years. They now want children to get the vaccines administered separately in order to minimize the risk of this type of seizure, often caused by a fever in healthy infants and young children. And as Gloria Milimu reports, the tweaking of their recommendations comes at a time when the MMRV vaccine continues to be linked with neurodevelopmental disorders like autism, impacting on the uptake of the crucial vaccine for children world over. Take a look.
Whether the new guidelines from the U.S. Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices will shape the perception about the MMRV vaccine is a question that public health experts around the world will have to ponder over. As confusion about the impact of MMRV vaccine abounds, the United States CDC's new vaccine advisory panel has made a controversial call, one that recommends against the administering of the combined MMRV vaccines in children below the age of 4 years. The committee cited adverse reaction from the vaccine that protects against measles, mumps, rubella, and chickenpox, saying that children below that age face increased risk of febrile seizure, a type of fever-induced seizure in children. Alternatively, they recommend that children should receive the vaccine separately in order to minimize this risk. This is not the first time the combined vaccine has been associated with adverse effects, creating hesitancy among parents.
We tell parents, look, these vaccines have worked. They are most probably the most cost-effective way of preventing numerous diseases, numerous illnesses, and to ensure your loved one is going to live a long, healthy life.
The MMR vaccine, which has been available since 1971, has witnessed controversial allegations around it, including claims that it causes autism, a neurodevelopmental disorder that affects 1 in every 100 children. Experts have now dismissed these claims, stating that they lack scientific backing. Like any other vaccine, the side effects from the MMRV vaccination presents with swelling and soreness at the injection site, a rash and fever, which more often resolves on their own, according to experts.
The last 2 years, now we're seeing an outbreak of measles. So we're seeing children being admitted for something that is preventable. That's something that a simple vaccine can prevent all those admissions, all those deaths. So why take that risk when you know this works?
The combination shot was developed to cut down the number of vaccines babies receive at the age of 1 and to also ensure that babies get all the required vaccines. As the US seeks to introduce the new guidelines, critics argue that the seizure is generally harmless and it's a side effect often seen in toddlers when the combo shot is administered. Whether this move will impact on the uptake of the vaccine globally is an issue only time will tell. Gloria Milimu, KTN.
Now, leaders in the United Opposition